Hello viewers, welcome to another vlog. I am Dr. Joydev and today I'll talk about hematology. So what is hematologist and who is a hematologist? I'll be talking about this. Hematology is a branch of medicine that deals with disorders of blood. It can be a benign disorder, it can be a malignant disorder, it can be any abnormality of hemoglobin, it can be any kind of abnormality of WBC or platelet. So let's see one by one what are the diseases that are managed by a hematologist. Now, coming from the disorders of RBC. RBC or red blood corpuscle, as we know that it is one of the important cells in our body which carries oxygen and carbon dioxide within our body. And any abnormality of this RBC and the hemoglobin that remains within the RBC. So any abnormality of hemoglobin or RBC such as anemia, that means there is low hemoglobin, low RBC. If there is high hemoglobin or high RBC count, that is usually seen in polycythemia, that is also managed by a hematologist. Any abnormal form of hemoglobin such as sickle cell disease, hemoglobin E disease, or if there is any kind of thalassemia, that is also managed by a hematologist. Now, next, coming to disorders of WBC or white blood corpuscle. Disorders of WBC can be low WBC count, such as leukopenia, or high WBC count in case of leukocytosis or leukemia. So these are also managed by hematologist. Now coming to any abnormal function of WBC that can be seen in a lot of disorders, and these are a bit rare disorders, although these are also managed by hematologists. Now coming to the platelet disorders, any platelet count abnormalities such as low platelet count or thrombocytopenia, that is also managed by hematologist. High platelet count or thrombocytosis, and even the malignancy that is related with high platelet count, that is also managed by a hematologist. Now coming to the bleeding disorders or coagulation disorders, if there is excessive bleeding or if there is excessive clot formation within our body, then these things are also managed by a hematologist. Now coming to the malignant disorders. In malignant disorders, the most common hematological malignant disorders is leukemia or blood cancer. Leukemia, in case of leukemia, there is uncontrolled proliferation of the blood cells. So this condition is ideally managed by hematologist. Now, coming to the group of disorders which is associated with the lymph node. Now, the most common malignant disorder seen in lymph node, that is lymphoma. Lymphoma is a type of malignancy that primarily involve the bone marrow. Later on, uh, it can involve blood or any other soft tissues or any other structures, bone marrow, etc. So these lymphomas are managed by a hematologist. Now coming to another malignancy, that is uh, that arises from the bone marrow. And here what we get, there is excess number of plasma cells, that is one kind of cell that can produce antibody and help us to fight against a lot of infection. But in case of multiple myeloma, the number of these plasma cells are increased and they are not functional. So in case of multiple myeloma, uh, although having more number of plasma cells, having high quantity of antibodies, but these antibodies are non-functional, and these antibodies are sometimes, they are not exactly formed, they are a part of antibody, or If it is a full antibody, then it is also non-functional. So there is high risk of infection. And other also there are some other complications, including renal involvement, or there may be lytic lesions within bone. So these conditions are collectively known as multiple myeloma or plasma cell malignancy. So these conditions are also managed by hematologists. Now coming to another condition that is known as hemophilia. In case of hemophilia, there are some factor blood coagulation factor defects or deficit. So in hemophilia patients, we see that we have to replace the factors or some blood products that contains those factors, and these conditions are managed by also hematologists. So these are some of the conditions which are managed by a hematologist. So please share your opinion regarding this video in the comment section, and if you like this video, then don't forget to hit the like button. If you are new to my channel, then don't forget to subscribe, and also before after subscribing, you can hit the all notification bell. Thank you.